Weakness of the pelvic floor muscles has long been identified as a cause of urinary incontinence. Pelvic floor muscle weakness is common after childbirth, and it's also associated with age. As people are going to live longer, pelvic floor muscle weakness will become one of the most important causes of urinary incontinence. Therefore, any treatment that can strengthen the pelvic muscles will carry great benefit in terms of preventing and treating incontinence. The treatment of incontinence and other pelvic disorders depends on strengthening the pelvic muscles. Traditional methods of strengthening pelvic floor muscles have involved active participation by the patient in contracting muscles and often involves techniques that are intrusive and uncomfortable. It is a passive treatment relying on magnetic waves which are used to stimulate the entire pelvic musculature, which is done passively as the patient sits in the chair, rather than having to actively contract the muscles on the instruction of his health specialist. The treatment involves the patient sitting in the chair passively and fully clothed. The treatments are repetitive. Each session lasts about approximately 15 to 20 minutes, and there may be a requirement for 10 or even up to 20 sessions. It can be used by all patients who are aged over 18, provided they have no medical contraindication to sitting on the device. All patients must be referred by a medical specialist who has identified pelvic floor weakness as the cause of their problem. In the vast majority of cases, this will be to treat urine or fecal incontinence, but there are a number of other disorders which are directly due to pelvic floor dysfunction that can be treated as well. The medical specialist will be able to identify patients who cannot be treated. Any patient who has a pacemaker or other medical device that could be caused to malfunction by the magnetic waves involved in this treatment cannot be treated. Furthermore, any patient who has had a hip replacement or metal orthopedic appliance in the region of the pelvis cannot be treated. The arrival will build on the traditional means of strengthening pelvic floor muscles. The particular advantage is that it's well tolerated, it's non-invasive, and patients can undergo treatment much more frequently than with traditional methods.